I'm Matt Willis, Public Health Officer for Marin County with today's COVID-19 update. Over the past 2 weeks, we've described how we've been seeing rapid increases in COVID-19 cases in certain low-income communities. And into this reality, the George Floyd murder occurred, sparking protests around the region. In Marin, we made a decision to support these protests to occur safely, even offering masks. Here's why public health chose to support peaceful protests. The protests are about change and shine light on the way the structures and institutions we've built hurt the health of people in certain groups. Here's one way the COVID-19 pandemic is playing out in Marin with regards to race. Nearly 90% of all cases diagnosed in Marin County in the past 2 weeks are in people who identify as Latino or Hispanic. As a white doctor, my best understanding of the experience of structural racism is through the lives of my patients. Earlier in my career, I spent 4 years as a physician in a hospital on the Navajo reservation. Today, that hospital is at ground zero for the highest mortality rate in the nation. My friends working there are exhausted and overwhelmed. Some of my former patients have died. The story of why that community is so impacted goes back so far to the earliest days when my race took over. Another version of that story is playing out here. Our lower income Spanish-speaking residents are 10 times more likely to be diagnosed with COVID-19 than other groups. The reasons are mainly structural, in the way poverty leads to conditions that spread COVID-19. People with low income are more dependent on daily income and are less likely to be able to work from home. Most have been out in the workforce since the beginning of the shelter in place, with increased exposure while the virus has been circulating. Second, due to rent and housing prices in Marin, people of low income share housing to pool income for rent. Living in crowded conditions increases transmission within the household and across generations. Thirdly, people of low income are less likely to have health insurance or regular medical providers. Finally, people in this community, especially immigrants, have an understandable distrust in government, including public health, and may not have access to basic information in their own language. Marin County is the most affluent county in the state of California and has the longest life expectancy. We also have some of the greatest disparities, with the largest gap in life expectancy between communities. People in Ross, for example, can expect to live on average 15 years longer than people in Marin City, just miles away. Those are the facts, the data, but it's up to us to apply meaning and to decide if we find that acceptable. Our COVID-19 numbers and disparities between communities offer the same challenge. These factors, the need to work every day to make ends meet, living in crowded conditions, lack of access to health care, and distrust of government support systems are structural. They are preconditions that the virus is taking advantage of. This is why I'm so concerned that we'll see more spread, because these problems are deep-seated and not fixed overnight. If structural racism led to the George Floyd murder, it is also accelerating the COVID-19 pandemic. We're working hard to address immediate challenges through offering temporary income support so people can step away from work if they're infected, offering hotel rooms so they can safely isolate from others for up to 2 weeks, removing barriers to testing, and using community-based partners to navigate patients into the supports we're offering. These are important measures. But just as my colleagues in Navajo lands do their best to see patients as they roll in, these fixes are a form of crisis intervention. They are not the reforms, the deep reforms we need to build a more equitable society. The protests happening around us, as long as they happen peacefully, with mask wearing and physical distancing, can raise our eyes to the fact that if we neglect any community, we all suffer. We've been saying that we're in this together, and that means all of us in Marin. Thank you for doing your part.